Hi folks, Michael Tapes. I thought I'd do a video update. My face is getting back to looking like myself. My mouth is much better. The swelling is mostly down and the pain is mostly gone. In any event, I'm doing okay. I think mental issues are more critical than my physical issues right now, but we all are facing mental issues in this new world that we're living in. So I thought what I'd do is just kind of do an overview of how I got here and where I'm going over the next couple of months. Okay. So I had my regular annual physical, and I complained of having some, it was not hard to swallow, but when I was eating, sometimes food would seem to go down the wrong pipe, and I'd be coughing a lot in any event. So I had trouble swallowing, and I reported that to her, and she took a look and said, "Holy shit, you got this hunker down there attached to what to her at the time appeared to be where my tonsils would have been. Also my lymph node on the other side. So the cancer was on this side, and my lymph node that she felt was swollen was on this side or the left side. So she immediately ordered for me to get a CAT scan, and that confirmed that there appeared to be cancerous stuff going on. She sent me to an ENT, an ear, nose, throat specialist. He did an examination, confirmed that this thing, this growth, whatever it was, appears to be cancer, but they'd have to do a biopsy, and in doing the biopsy, he basically removed the tumor. And in the pathology of the tumor proved to be squamous cell carcinoma is what they call it. So that's the kind of cancers you get in head, neck cancer. So it turns out the cancer the tumor was attached to the base of my tongue. So that's where the cancer was. Okay. So from the ENT, he sent me up to Orlando Health to seek their opinion and what have you, and to get treatment. So I met with their surgeon, and they, did an exam, looked at what was done. He ordered a PET scan, which confirmed that the cancer, 1, was there, and 2, wasn't anyplace else. So that's the good news. I believe they call it a T1N1. So the T1 is for one tumor, and the N1 is for one node, if I'm doing that right. In any event, let me just say something about this organization I'm working with called Orlando Health. It's a nonprofit affiliated with the University of Florida and the Arnold Palmer hospitals. And anyway, all I want to say is I have never had a better healthcare experience than going there. I've probably been there a dozen times, meeting with 4 of my team, the oncologists that are working on me, plus ancillary people doing tests and so forth. And the experience has just been great. Everybody has been wonderful. They have great IT solutions where I can just email a question to them, and I mostly get an answer in 1 or 2 hours. Or if the doctor is busy, they'll tell me the doctor's busy, and they'll get back to me. Just everybody from the scheduling on down has been great. So it's been a super experience. So when people ask me if I got a second opinion, I just feel so confident in this team and what's going on. So I have a surgical oncologist, a chemotherapy oncologist, a radiation oncologist, and a dental oncologist, in addition to the ENT oncologist that I worked with, as well as my GP. So they're all, part of this team and so forth. In addition to the PET scan, I had a barium, so I had the surgery, got rid of that, had a barium swallow test, which basically is a video x-ray, and it shows how you swallow and all, and that was perfect. And by the way, if you've never seen one of those, there's the phone. Let me grab that. The phone. Scam calls. So the swallowing mechanism is so interesting. You watch it, you chew, and it gathers all the your mouth and tongue, get this whatever you're eating into a ball in the back of your mouth, and then it like shoots down your esophagus. It's like watching a bullet go into gel or something. It's just so fast. It's anyway, very interesting. But that all proved that my whole swallowing mechanism and everything was perfect, and that all my swallowing problems were that tumor that they took out. Okay, so now we have to address the cancer. Bottom line is no surgery, because if they did surgery, my whole speaking, swallowing, breathing, eating, everything would be screwed up. So the surgery just isn't an option. So they'll be killing the cancer using radiation. I'll be getting 5 treatments a week. And sort of as a chaser, as I call it, or a catalyst, is 1 day a week of chemotherapy. So I'll be going up to Orlando 5 days a week. On 4 of those days, it'll just be radiation. And on 1 of those days, it'll be radiation plus chemo. The chemo is a long process in terms of sitting there and doing it. The radiation takes, 10, 15 minutes to do. They sit me in a cage. I'll give you more details about that after I meet with them about that. But the chemo is a long process because first they have to do blood work before they're going to give you the chemicals. Then they have to give you fluids. Then they give you the chemo. Then they have to give you fluids. The fluids are to help your kidney, so all these poisons that the chemo is putting into your body doesn't wreck your kidney. So those days will be full days. We have an hour drive up to Orlando plus an hour blood test, an hour fluids, an hour chemo, an hour fluids, plus the time in between, and so forth and so on. So I'm not exactly sure how we'll manage that, but we will. So I probably lost my train of thought, and look at that. There's my healthcare people. I asked them a question this morning, and they're coming back with an answer, so that's great. In any event, let's talk about fear, pain, scared. Yeah, of course I'm scared. We're all scared. Coronavirus and so much stuff is going on. It's it's a nightmare for all of us. This obviously renders my cancer diagnosis renders this a, wacky thing where I'm going to start treatment where the peak of the coronavirus is hitting us here in Florida. But I think I'm confident about that. I did speak to them about delaying the treatment, but they said no. This is more important than the coronavirus, and I'm sure they have it covered. The hospital where I'm going to, again, Orlando Health, I'm in a separate head neck cancer center, so I'm not going to be with coronavirus people or even regular hospital people. Although I have to tell you one quick story. When I had my 4 teeth extracted, which was a week ago today, it was done in an operating room, surgical operating room. And so I'm sitting there having my teeth taken out, and the guy next to me is having a colon resection and, just regular surgery. So this is a regular operating room. And I asked the nurse, and again, everybody was incredible and wonderful. I asked one of the nurses if it's going to be on time. I was scheduled for 7:30, and this is about 6:30. She said, "Oh yeah, it'll be on time." And she said at about 7:20, this place is going to look like Demolition Derby. All these beds going out and everybody getting ready for this. I said, "How many surgeries are you doing here?" They said, "Oh, we're doing 24." Simultaneously. So they were supporting this pre-op room I was in was supporting 24 simultaneous operating room surgeries, ranging from, taking out my teeth to, whatever you do in surgery, colon, anyway. Wow, it's a big facility, and they seem to have their act together. I lost my train of thought again, but that's what happens. Being scared and so forth. And as you can see, my short-term memory is not doing very well. Part of that is the drugs I take for my depression. And part of that is I'm 70 years old, and part of that might be dementia. I don't know. I have no way to judge, what's going on with my brain, and it makes it very difficult to plan for the future in terms of my business and so forth. So I'm confident that I'll get through the cancer, but it's obviously going to be heavy turmoil. The first couple of weeks they say is okay, week 1, week 2, but starting week 3, 4, 5, and through that, the radiation causes a major, well, it depends if it's major or minor, depending on everybody's individual, but a major sunburn-like burn on the outside of your throat, and unfortunately also on the inside of my throat. Also, I'm not going to be able to eat or swallow or so forth, and you have to eat. So much to the point where they said if you want to eat Velveeta or a McDonald's milkshake or what have you, you just have to get your calories. I don't care what you eat, but you got to do it. And they threaten you. They have this sledgehammer to my head called a feeding tube. And if I don't keep my weight up, if I start losing weight, they'll have to surgically put in a feeding tube to feed me because my body can't be losing any weight and fight the cancer at the same time. So anyway, it's a scary proposition. You know, I know I'll get through it. I'm not good with pain and stuff, and the logistics are awful, having to drive up to Orlando, the coronavirus that we're all facing. So all I can say is, doing the best I can. And the support of, number one, I wouldn't be doing any of this in my brain if I didn't have Ronnie at my side. So that's the first issue at hand. That's the only way. People say, how could you be so, you're facing cancer and you're not crying? And well, I have Ronnie. So that's my secret weapon. And all of you folks that have been incredibly supportive and so forth. So I think I'll just end it now. So I'm doing better and so forth. We go up there again on Wednesday. So, they've been waiting for my the face and teeth and mouth to heal. So I go up there Wednesday to see my dental oncologist and the head of the team, and we'll lay out the next step would be mapping out the radiation, how they do it and all. And that's called simulation, and I'll do that in another video another time. So thanks, everybody, for your support, your well wishes, and so forth. You're free to call on my cell phone. I pick up or don't pick up depending on just how I'm feeling, just mentally and physically. I go up and down. How much of that is the cancer, how much of that is my normal wacky brain, and how much of that is being 70 years old, and how much of that is dementia. I have no idea. But, I'll fight hard. Ronnie's at my side. I love you guys, and I'll talk to you soon. So you all keep safe. Wash your hands, don't touch your face, and if you're in a bad area, just get out as quickly as possible. I read an interesting article today that the less the exposure, if you were near somebody that was corona positive, if you're near them for 30 seconds versus near them for 5 minutes, huge difference. So, it's not only it's the amount of virus you get, or at least that's typical of these type of viruses. They obviously can't do human tests on this, but anecdotally and from all other virus studies, that's important. So limit your time. So 6 feet, 6 seconds when you're going through the supermarket. Don't touch your face. Wash your hands all the time. You know the drill. Stay safe. And I know a lot of you are facing issues that I'm not facing that are just as traumatic. So, don't cry for me, Argentina, or something like that. So we're all praying for each other, and God bless.